Hi guys, I wanted to share my thoughts on the Professor Musings about racist parents. And from the conversation generated on the discussion board, it seems like many of you were leaning toward a case by case approach. And that kind of approach, from an institutional point of view, and we will be getting into institutional liability next week, concerns me for a couple reasons. If you remember, I talked about the importance of predictability and stability within the law. A hospital taking a case by case approach does not provide that, and it could actually open them up to additional liability if a physician or a patient feels that their accommodation was not, or their request wasn't accommodated in the same way. In terms of having a standard policy and making sure that you're enforcing the 64 Act, which refuses or bans discrimination on the basis of race, gender, national origin, I think it makes sense for the hospital to have a consistent approach that's applied each time. The only area that I think would allow for some flexibility would be if the request was couched as a religious accommodation. And if you saw from the article, those seem to be the cases that lent themselves more to a case by case approach. And even then, having a uniform policy in the way that they are evaluated, I think makes the most sense. Especially, you have to think of liability in two ways. In terms of an institution opening itself up to potential liability on the place of its employee by removing me on the basis of my race or my gender, that could be problematic. In addition, allowing patients to continually abuse physicians, as was mentioned in the article, also gives rise to a hospital allowing or maintaining a hostile work environment that an employee is forced to care for patients in. So it's a sticky issue, but again, I would go for a more consistent approach of refusing to accommodate requests from patients that are grounded in racist or bigoted intent. And to the extent that there is a religious request, have a uniform policy for evaluation to determine whether or not you will accommodate that.